Ladies and gentlemen, please take your seats. The program is about to begin. Ladies and gentlemen, please take your seats. The program is about to begin. Ladies and gentlemen, please mute your cell phone. Ladies and gentlemen, please welcome Miss Kathy Calvin, President and CEO of the United Nations Foundation.
Good morning. Thank you all for being here. It's a pleasure to see we have 4,000 people from 56 countries at the mHealth Summit this year. I want to thank our partners HIMSS and the NIH and NIH Foundation for the creative work in making this such a full, impactful, and rich schedule, and something that all of you have helped us co-create every year as we plan it. I'm so proud to be here. I'm Kathy Calvin. I'm the CEO of the United Nations Foundation. We were founded 15 years ago by Ted Turner, another great innovator and visionary in the tech field, who wanted to do something to support the United Nations, make sure the U.S. always appreciated its strategic value to our country, and most importantly, to have the ability to create public-private partnerships in support of the great work the UN does around the world. There's probably no better area for us to demonstrate the power of public-private partnerships than in mHealth. So several years ago, when the mHealth Alliance was being created, the UN Foundation stepped up and said we would be happy to host it, and we are a strategic and founding partner of the mHealth Alliance. We're big believers in all things mobile, and under the direction and leadership of Patty Michelle, the mHealth Alliance, as you know, is making significant strides. We've seen the power of mobile technology improving health care for people who often don't have access to the services that they need. And we're also excited that the Mobile Alliance for Maternal Action, you might know it as MAMA, is launching their first program in Bangladesh later this month, with South Africa and India quickly coming on board. We know that's going to be another great demonstration of what can happen when we bring the power of technology to a really vital service. My first order of business this morning is to kick off our program with a phenomenal speaker who happens to be a member of the UN Foundation Board, but has many other attributes to bring her to you today, and it is Dr. Nafis Sadek. Dr. Sadek began her professional life as a physician, practicing obstetrics and gynecology in rural communities in her native land of Pakistan. In 1987, she became the executive director of UNFPA, which is the UN's population fund, with the rank of Undersecretary General. This made her one of the highest-ranking women in the UN system and the first woman in the history of the UN to lead one of its major voluntarily funded programs. She's currently our board member, but she's also a dynamic leader and a guiding force in the field of international maternal and child health and reproductive and sexual health, including family planning, as you'll hear today. She champions the idea that women's health and well-being are best approached through the lens of reproductive and sexual health within social and economic context of all women's lives. She's going to speak to us today about her interest in the role that mobile technologies can play in improving the lives of women around the world. Please join me in welcoming Dr. Nafees Sadik.
Good morning. Thank you very much, Kathy, for a very wonderful introduction. I'm very pleased to be here at this very important global summit. I think it's an idea whose time is not just come, but is long overdue. I would have added something else in the end of that. The technology, business, research, and policy is programs, of course. But I assume that this includes programs. The mHealth Alliance is the ultimate partnership. It combines the power of technology challenged in the private sector with the power of public institutions and not-for-profit foundations, synergizing the best aspects and increasing the capacity of all concerned. I was very happy to be part of it as a doctor, as a scientist, and as a former head of the UN Population Fund, and now, most importantly, as a board member of the UN Foundation, and of course, as a woman. The mHealth Alliance is a step towards better health for women. It is a step to increase and promote gender equality, two aims which are closely linked and for which I have worked all my life. I want to say to you that I'm 83 years old, so you can see I've had a long history and a long experience behind me. And I started with the concept that health was just health services. And I quickly realized that health for women is not just the provision of services, which is an essential part, but also to take account of their environment and where they live and their conditions of life. The spread of mobile technology is the biggest and the fastest change in my lifetime. When I started work as a young OBGYN in Pakistan, if you had access to mobile technology, it meant that you had a car. In the villages where most people lived, for people who had never seen a telephone, and a few still had ever heard of one. Those were the kinds of technologies we talked about then. Today, mobile phones are everywhere. Even in the extremely poverty-stricken countries of the world, you see mobile phones everywhere. In my country, and I saw in India as well, all the beggars had mobile phones. And I was asking them why they carried mobile phones. They said, well, we tell each other, our connections, where the best place to stand is, and they move there quickly. So you see the multiple uses of mobile phones. I think the crossing the email means helping many minds on the bikes and in the mopeds around the world in our very physically challenged environments where health centers are located, really is idea who you wonder why it didn't start off much earlier. Men still sit in the cafes as they always did, with cups of coffee in their hands, but on the other hand, instead of water pipes, each one also has a telephone. There are now 110 million cell phones in Pakistan alone. I think there must be like say 700 or 800 cell phones in India. And so on in all of the countries. I think in Bangladesh, I'm not sure that every single family does not have a mobile phone. Mobile technology has enabled traditional businesses and sparked a whole range of new businesses. Farmers and bus drivers and truck drivers have them. Fishermen who are out in their boats have them. And of course, young people use them in all sorts of different ways. Of course, some of the health issues are being challenged by the use of mobile phones. And I'll just use one example, the HIV/AIDS area, where the sex workers are no longer in brothels but are using mobile phones. So access to giving them services has become much more difficult. I'm sure that your minds will work on this aspect and find a way to put them together somewhere. As a result, we are all changing. I'll see you on Facebook and in perhaps in some George Orwell type of setting. Some are changing more than others. Whole groups are left out of the mHealth business, of course, and that's the group that we need to get access to, especially the poorest of the poor. Women in, I have to tell you that the lighting here is terrible. Women in general are just likely than men to have access to mobile phones. But in Asia, I noticed that that is really also changing, that a lot of women have access and sometimes their husbands don't. I think that's a good sign that women are sort of using technology much more aggressively. But in any case, it can make a huge difference to everyday life, and certainly in the health area, it is making a huge difference. But for the mHealth Alliance to be fully successful what is needed is that it must reach the women most in need, the less privileged and the most excluded, precisely the women least likely to have access to mobile technology. Bringing mobile technology to these women is a major challenge that the market almost cannot meet, but I'm sure with all the brains now that are working on this, you will find a way to do that. The second challenge is simply to deliver services to all who need them. Sexual and reproductive health services today are directly mainly at women and their children. They often do not reach the poorest, the young people, the unmarried, or many men who seem to be out of the service. And here men are a disadvantaged group. They do not reach groups on the edge of society like migrants, street people, the LGBTs in our countries. And again, the market alone cannot solve the problem. The third challenge is to empower women themselves to reach out and make use of the tools and the services that are available to them for through all these alliances and services. It means that women must be able to take advantage of those services like health and education, because they don't know the power of decision over their own lives, but that can raise themselves, and that their own move, if they don't have the empowering services like health and education. But again, to make that happen, the changes have to take place in their families and in their societies. Technologies can help them in leaping the obstacles that plenty of women have seized the opportunities that have been offered to them through this mobile technology to improve their own businesses, and some even create businesses, for example, by renting out some of their cell phones and and making calls on behalf of people. This is very common in Bangladesh, for example, and many women are earning a living just doing that. Thanks to mHealth, more and more women are educating themselves. They are accessing health information and advice about services and also about their own needs. These women are everywhere in the developing countries, but they are very much the minority. I want to underline this point. Mobile technology is a very useful tool, and I hope it will soon be owned and available everywhere. But it is, in short, needs to have an effort put in to make that happen. It must be combined with targeted investment in women's health services and equally important education and information services that can be accessed through these mobile technologies. I'm sure things that you are working on together, and that the very important message for mobile phone users and makers and carriers is also important, that all these aspects must be addressed together. It's also, in our countries, it's important for the government to be involved, because to get this access and scale up services, it's the government that provides all of the services everywhere. And they must at least be positive towards it, and in some cases maybe even helpful, though not always the case. But the private sector, obviously working together as you are doing in partnerships, can do very tremendous things. Healthcare for poor women is often rudimentary, or in some cases totally non-existent, especially, as I said, sexual and reproductive health. Pregnancy and childbearing are issues that you are focusing on, major cause of death and disability in developing countries. In some countries, the major cause of course, are budgetary and individual initial reasons for, which is that women's health is very much neglected in the health sector itself. But the real barriers are not technologies or financial, they are in people's minds, as some of you who work there must have already realized. Let me give a few examples. In my travels and discussions, I find policymakers who still regard health services for women as a matter of charity or of social issues, which are, which can be left out if resources don't permit it. Especially preventive and basic healthcare or primary healthcare. They look at education sometimes in the same way, though I think the importance of education is becoming more and more visible. They can't or won't see the economic benefits of empowering half the population. That's 50% of the world's population, and indeed a little bit more in many countries where life expectancy for women is higher. Certainly for the business community, these are the consumers of the future, and especially when they become decision makers. Policymakers are reluctant to extend information and services to young people, especially in the field that I work on, sexual and reproductive health, including HIV/AIDS prevention often, apparently believing that what they don't know will not harm them. And of course, we know that quite the contrary happens, and that girls don't what girls don't know seems to kill them every day. Maybe a slight exaggeration, but it is absolutely true. Many in more countries, in most countries, girls are ignorant about sexual matters, reproductive health matters, and they don't know about them until they are married. They remain especially vulnerable to HIV infections, high-risk pregnancies, illegal and dangerous abortions, and so on. In the world of mental obstacles, marriage is seen as a safe haven for girls in many of our societies. But again, people are wrong. Early marriage means early pregnancies, which can be and often is fatal for girls under a certain age. In fact, in maternal mortality, as many of you will know here who are experts, in young people is higher in many of our developing countries than births at a later age. And then they have many side effects and so on, which are often not treated, pushing them out of the labor force and pushing them out of their normal lives and not in part of the social system. There's a human rights aspect here, of course. Girls and women have the right to decide on matters that concern their own lives and their own health, but many in our societies, as you know, don't have those rights. And I'm making these points just to show you that it's not just health services alone, but there are other issues in our society that must be addressed if we are to get services to those who need them, especially in the rural areas. And in most of our developing countries, it's girls and women the services for whom are not given the proper priority. Finally, men in general seem to also have a mental block, especially in the area of obstetrical services, sexual and reproductive health services. They have a double standard about sexual behavior. They refuse to take responsibility for avoiding pregnancies in many of our societies still in 2012, or they should be, or for sexually transmitted diseases. They think of pregnancy and childhood as something that just happens and is normal, and that it's normal if the girl or the woman dies. And they also have to be educated and informed, and I think mHealth programs must target also public education as part of their drive to improve the health of the marginalized and hard-to-reach populations. Removing the mental aspect should then be one of the primary aims of the mHealth Alliance and of the partnership between mHealth and health providers. The first message for our advocacy should be that gender is not a niche or a minority issue. Women are half the world, as I said earlier. They have the same human rights as men, including the right to health and education. Protecting the health and promoting the education of women and girls is also essential for sustained and equitable development and for equitable health services and access to these services. Holding back women holds back development for the entire country. Secondly, we need a frontal assault on gender discrimination. Along with poverty, gender equality has been accepted and assumed to be a fact of life. That, as we know, is wrong. As with poverty, we challenge these assumptions. The mHealth Alliance must address gender issues, including gender-based violence, the connections between poverty and women's health, economic security, and special investigation, including the right to raise and vote and hold office, and all of those things need to be supported and could be essential part of the mHealth educational package. Thirdly, integrated sexual and reproductive health services should be a primary goal of healthcare providers, or should be an essential goal of healthcare providers, and a primary target for my view of mHealth advocacy. In the real world, women don't lead separate boxes for family planning, for HIV/AIDS prevention, for maternal and health obstetrics, or even for the care of their children. They don't, therefore, not have to go to different boxes to get all these services. I think the mHealth Alliance, as it's developing its models, need to see how in essential information on many aspects that connect with each other can be provided, and while you are also organizing your services, how you can bring them to one-stop services rather than having to go Monday to something, Tuesday to another thing. If you know the lives of poor women in many of our countries, that's going to be impossible. So some of these areas will suffer, and mostly the areas that suffer are the ones that that concern their own health and their own lives. I think that women don't have a lot of time to look after their own health, and the way that we can make it simpler is to simplify the kinds of things that they must do to get their basic health services. Finally, men must take responsibility for their own behaviors. Men must also be responsible for the health of their families. In most of the societies, men make the decisions, and therefore it's essential to target men in the education and in the information programs. I think in many of our countries, culture and values, etc., are used as an excuse not to do something. As I have always said, culture is meant to protect everybody. They cannot be used to discriminate against a group of people, and most of the discrimination and cultural practices, as you may know, are directed at women. We need to find a way to condemn these practices. All strong cultures find a way to adapt and to change. And culture is not a static thing, it changes, and therefore we must also be able to speak out on these issues in our advocacy kinds of programs. In our advocacy, the mHealth Alliance should be pushing at on all aspects together. Countries have accepted all of these aims, including the basic aim of women's empowerment, of gender equality, of access to full health services, to sexual reproductive health services. These are all part of the Millennium Development Goals. I'm sure you have heard of those. And progress towards these goals is happening. In some countries it's quite rapid, but the one goal that is really far behind is the one on gender equality and reduction of maternal mortality, even though there have been some progress, but a lot of countries are lagging behind. So the area of women's health in the Millennium Development Goals is the area that is lagging behind, and for all of the reasons that I've already stated, of the low priority given to women's health, the low attention given in the services, etc., is the reason. The Secretary General has, as you know, launched this major program, Every Woman, Every Child, and as you know, the UN Foundation has its own very impressive program of the Girl Up, which in fact starts to look at the health of girls before they reach maturity, and look after the needs of girls in adolescence, etc., through a big partnership. And I hope that the mHealth Alliance in that area will develop technologies which will help these programs. And let me make a few suggestions for immediate action. First, mHealth should include women in designing the technologies and systems in programs meant to benefit women. Secondly, mHealth should encourage women's involvement in disseminating systemic obstacles to participation and help them on how to eliminate those obstacles. Third, mHealth interventions should include women's empowerment and gender equality as an underlying issue that affects their health status, but also affects their ability to use the health services that are provided to them. And the mHealth workers that you will be addressing, a lot of field workers, etc., need to also understand and find ways to deal with that. For example, if you tell, an mHealth extension worker talks to somebody and she gives all these symptoms of what's happening to the woman in labor, and the final advice to her is bring her into the hospital. She has to find the husband, she has to find transport, and she may never be able to get there. One has to think of solutions for situations like that. I know that some women will not be able to get the services they need, but maybe there must be some ways to use the extension worker, the person that's on the ground, which is the reality in many of the countries in the developing world, give the best that they can and forget whether she's allowed to or is supposed to or not, but how to actually save that life. I want to leave you with that message that saving lives is your mission, and I wish you all success, and I think this is the way of the future. Thank you very much.
Well, you can see why the world is lucky to have Nafis Sadik as a champion for women and girls. And I'll tell you a little secret. It's not really a secret. She celebrated her 80th birthday a few years ago. Pretty amazing woman and a real champion. So I want to bring on our next speaker, a keynoter who's with us today, and we are very, very fortunate because Dr. Ariel Pablo Mendez was appointed by President Obama in 2011 as Assistant Administrator of USAID, the U.S. Department for Aid for Global Health. It's a big job. It covers child mortality, maternal mortality, AIDS, a number of other big issues, and it's a big job, and he's the right man to do it. Before coming to this important job in our government, he was at WHO in knowledge management, and then as an experienced public health physician from Mexico, he most recently served as the managing director at the Rockefeller Foundation, leading their global health strategy on e-health and the transformation of health systems in Africa and Asia. I have to say, without his leadership and his vision several years ago, the mHealth Alliance might not exist. He was instrumental in pulling the entire community together at the Bellagio Conference Center that the Rockefeller Foundation runs, and out of that came the mHealth Alliance and much of the movement we're celebrating today. So please join me in welcoming Dr. Ariel Pablo Mendez.
Good morning. Thank you for this opportunity to speak to an incredible community of innovators and entrepreneurs and many others who are also, in the case of global health, serving the cause of the poor around the world. 4 years ago, we were in Bellagio with the UN Foundation and the Rockefeller Foundation and many others, and it was really the meeting where the mHealth Alliance was born as an idea. At that time, my colleague Carl Brown, who might be in the audience, put forward the idea to Wikipedia to enter mHealth into Wikipedia, and the editors rejected the term as a neologism. It was a made-up idea. What was that? And here we are, just in 4 years, an incredible mobilization around the world, coinciding, of course, with the incredible and well-documented expansion still ongoing of cell phones access around the world, particularly in our case, in the developing world. We work in over 80 countries for the last 50 years with programs in global health and other areas of development, from communities to governments. One of the key objectives or goals of USAID is seeing an end of preventable child death and maternal mortality. While we have made great strides in ending maternal and child deaths in recent decades, it's quite astonishing actually. There's still much work to be done. In 2001, nearly 7 million children died before their 5th birthday. That same year, nearly 300,000 women died during pregnancy or childbirth. And there were 390,000 new HIV infections in children. Infectious, life-threatening diseases like pneumonia, diarrhea, malaria are further exacerbated by malnutrition, poor access to health and services. It's a tough job, but a wonderful job. We know that good health provides dividends for life. Children who are healthy and well-nourished avoid permanently disability and spend more time in school. They also are more productive, and their parents also are more productive. We've seen extraordinary progress over the last 50 years, as child mortality rates around the world have declined by over 70%. In just the last 2 decades, more than 50 million children's lives have been saved. People are now living over 20 years longer than we used to. Also in the developing countries, the gains in what we call the global south are actually faster, and the gaps between rich and poor are narrowing. This past June, at the Child Survival Call to Action in Washington, world leaders embraced the strategic shifts necessary to further speed up progress in reducing preventable maternal, neonatal, and child deaths. These shifts include increasing efforts in countries where most deaths occur. 5 countries account for 50% of all child deaths in the world. It almost feels like polio, 3 or 4 countries where the big action needs to take place. We are also focusing on the most vulnerable populations, clearly the poor, that your dollars will give you the best bang for the buck. At the same time, it's harder, but actually efforts have shown that gains do not slow down as you go into the last mile. And investing in high-impact solutions and innovation to address the bigger killers of kids, including now quite prominently neonatal complications that account for 40%, 50% in the case of Asia, of all child deaths. These high-impact solutions are evidence-based, life-saving interventions that many of you already are familiar with, from expanding contraception choice to preventing and treating maternal complications, immunizations, preventing the transmission of mother to child of HIV, treating newborn sepsis, all of that. But while we have a good understanding of what and with what to address these problems, there is still a lot of room to improve on the how, to get them to mothers and children who need them at scale, in a sustainable fashion, at the precise moment that they need them, with high quality and affordable cost, what we call the science of implementation, adapting, scaling, sustaining solutions. That's where we believe that the potential for mobile health in the developing world, in the global south, is greatest, serving as a tool to help us ensure that everyone has access to appropriate health services at an affordable cost. This is the very definition of universal health coverage, and we believe that we're going to see an expansion in health coverage around the world. There are several ways in which mHealth can help us in addressing the challenges in global health in the global south and leapfrog health systems to do better. Addressing the needs of patients, providers, health information systems, payment systems, as we do in this country, we also need appropriate systems to do so in the global south. First, mHealth can empower patients and caregivers with the information that they need to improve their own health and that of their families, and to seek appropriate care when illness strikes. For example, MAMA, the Mobile Alliance for Maternal Action, is a public-private partnership between USAID, Johnson & Johnson, with the United Nations Foundation, the mHealth Alliance, and Baby Center, and many other supporting partners. This partnership aims to inform and empower low-income expectant women who are at risk of complications and death during pregnancy and childbirth, as well as new mothers caring for their infants through text messages and interactive voice response. The traction of these interventions is fantastic. I've seen it on the ground in Bangladesh. This October, MAMA won the Fast Company Innovation by Design Award in the service design category, highlighting the possibilities for mHealth to do good in the South while also being quite competitive globally. CycleTel is a unique mHealth service developed by Georgetown University's Institute for Reproductive Health with funding from USAID that offers a family planning method directly to users of mobile phone via text messages. CycleTel is based on the standard days methods, a fertility awareness method that helps women know which days during her menstrual period is the most likely to become pregnant. Such standard days method has been proven to be more than 95% effective when used, and cell phones help us do that in preventing pregnancy when used correctly for those who do not want to get pregnant. Second, mHealth can help healthcare providers provide high-quality services by improving their use of evidence-based practices. Grameen Foundation last year received a Saving Lives at Birth Grand Challenge grant co-founded by USAID, the Norwegian Ministry of Foreign Affairs, the Bill and Melinda Gates Foundation, Grand Challenges Canada, and the UK Department for International Development to scale up their community health worker platform in Ghana. And this year, DIMAGI received a USAID Development Innovation Ventures grant to scale up their community health workers platforms in India. Both of these mHealth solutions give community health workers the tools they need to manage their patients more effectively, equip them with evidence-based decision support tools, and counsel their patients on health promotion and treatment compliance. And of course, the Empowering Frontline Health Workers Alliance is now an innovative public-private partnership designed to improve child health by accelerating the use of mobile technology by millions of health workers around the world. The partnership was announced at the Child Survival Call to Action that I referred to, with 10 founding members: USAID, UNICEF, the Frontline Health Workers Coalition, Qualcomm, Vodafone, Intel, the MDG Health Alliance, Glaxo, Precate Foundation, and the Absolute Return for Kids. So there are many people willing to help. Third, mHealth can also help us strengthen health information systems. That's sort of the origin of information technology, although we believe cell phones and mobile health is more than just information. It is really changing behaviors, changing the way in which health systems operate. The Open MRS is an open source electronic health record solution that links together various sources of patient data and enables providers and managers to improve the quality of clinical care. There's also IRIS, an open source human resource information solution that gives managers the ability to improve the effectiveness and efficiency with which they recruit, train, deploy, and retain healthcare workers. And last, mobile money, which we believe can replace cash in a growing number of countries and help increase the speed and efficiency with which health-related payments are made. For example, mobile money can be used to pay health insurance premiums, make health providers payments, pay salaries, replace paper-based vouchers, and process conditional cash transfers more efficiently. You can imagine in developing countries that efficiencies of more than 20–30%, and a lot of the corruption that sometimes happens in moving money is also addressed. The Better Than Cash Alliance was recently founded by USAID, the Bill and Melinda Gates Foundation, Citi, the Ford Foundation, OMIDR Network, UNCDF, and the Visa Group to explore these opportunities over the next several years. I believe all of these pieces are great, but bringing them together where needed and integration is what we are after. I can imagine a platform, an integrated suite of applications for a woman in a poor country that help us space or delay the pregnancies, that help us have a healthy pregnancy, that help her address a healthy baby, that you can use to encourage with vouchers for services and so on. That integration is what the field of e-health and mHealth is about. To conclude, mHealth is without a doubt a promising new tool in our global health toolkit. But we are only as good as we make it happen in countries on the ground. And we are just now starting to understand how we can further speed up progress in reducing preventable reproductive, maternal, newborn, and child health deaths. USAID is committed to working with all of you to find and deploy sustainable solutions at scale for these challenges. Thank you, and enjoy the final day of your summit. Thank you very much.
Thank you, Ariel. Very inspiring, good leadership. It's what we need, and a good challenge to all of us. So Our final piece this morning that I'm leading is the Corporate Spotlight. This is going to be an interactive session between two speakers, Dr. Mark Bott of Intel and Dr. Ebenezer Appiah Denshura of the Ghana Health Service. They're going to tell you a little bit more about themselves in this process, and they're going to have a conversation, but I'll just say to you that these are two men who are leading innovation and delivery of mHealth throughout the world. They're taking on some of the biggest issues around transport, infrastructure, delivering cost-effective health care in lots of different countries around the world, and I think you're going to find this a pretty exciting and interesting exercise to watch the two of them put their heads together in our Corporate Spotlight segment. Thank you.
Hoping some slides come up. We actually did put a presentation together. I can see it down there, and hoping it comes up here. Okay, I'm Dr. Mark Blatt, Intel's Worldwide Medical Director. Wanted to talk to you a little bit about mobile health and mobile technology. We've heard a lot about phones while we were at the event, and while phones are absolutely a fantastic way for delivering information and consuming information, wanted to talk to you a little bit about what the promise of mobile technology and mobile health might look like if we started to move beyond the phone. At Intel, when we start to look at mobile technology, we often start with the task that we're trying to accomplish. What am I trying to do when I go mobile? How can mobile technology enable me to do something differently? So I start with the task I'm trying to look at, and then I start to think of the right tool that helps with that. And one of the things we start to think about that we want to move towards is collaborative workflow. Mobile tools actually offer the promise of collaboration. I'm a family doctor by training in the U.S., and most of the time in the U.S. healthcare system, we work in fragmented data silos. You've heard a lot about that at the event. How can we use mobile tools to actually integrate care? We can start by consuming data. We can start by reviewing data. We can start by creating a little bit of data. But mobile tools offer us the opportunity to share data through a virtual system to providers and deliver care, education, training, analytics where it's necessary. Mobile tools offer the opportunity to do more than just look up data. While looking up data to make informed decisions is a great start, we can do more with mobile. We can do more with mobile technology than just look up data. Looking at how we educate our providers, how we deliver them interactive education, both in a pre-service level for training and actually continuing education when they're out in the field. Interacting with them in an educational manner and offering teleservices, telemedicine services. The phone might not be the best technology for that. The phone might be the best technology for field-based diagnostics and field-based interactions. The phone might be a great technology, again, for presenting and consuming information. As I go mobile, though, I might want to work online and offline. Mobile tools are great when they're connected, and they're great when they're connected to networks, but they offer the power of bringing education to remote areas where you go online and offline. They offer the ability to do data analytics and improve decision support and education for remote providers on their own when they're in a disconnected manner. These are actual real pictures that we've done as we've gone through using mobile tools around the world to actually improve things. We're going to hear from Dr. Appiah about a school and a school-based interaction program that is running in Ghana to help improve pre-service education, and will move to ongoing education. But the ability for mobile healthcare workers to be informed, to better present information, to do population health surveys, to look for disease surveillance, to again do remote telemedicine consults. The ability to staff a clinic in a remote area. The picture in China is actually a rural clinic in the mountains of Hunan that I ended up visiting, and the doctor was using remote technology with an internet connection to actually deliver services in a one-room clinic. It improved his ability to be both educated, to make informed decisions, and actually to get paid better and quicker and on time. The ability to actually build virtual capacity in virtual hospitals. So maybe I want to spend a moment here on this concept. This is a developed world slide that I've often used to talk about how care should be integrated, how data should actually flow, not just from the community hospital worker to the developed hospitals. And when we think of telemedicine, it's kind of like tertiary consults. But how can we go beyond that? How can we use these tools to empower citizens to better care for themselves so we diminish the pressure on the healthcare system where we have capacity problems in third world countries? How can we educate citizens to help care for themselves in an ongoing fashion? How could we work with emergency services, possibly where transportation is very difficult, to treat in place? So in many ways, mobile tools offer emerging economies the opportunity, pardon me, not to make the same mistakes that we've made in developing worlds in building our Western healthcare system. As we know, in most Western worlds, our healthcare system is completely unaffordable and is collapsing of its own weight at this point. I think in the emerging world, they have the opportunity, much like they kind of leapfrog from landlines to cell phones, they have the opportunity to think, how do I develop a virtual system where virtual care makes sense? It doesn't make sense everywhere. We need bricks and mortar facilities. But how do I pair virtual care with bricks and mortars in a grounds-up design? Not how do I introduce it and shoehorn it in as we're being forced to in the developing world, but how do I put this together in an ongoing fashion? How do I make a difference? How do I lower care, increase access, improve the quality of decision making? If I'm using mobile tools just to consume data, I'm not taking the full advantage of what mobile can do and mobile technology. I want to be able to empower citizens to work offline, online, to make decisions, that the information for the citizen is secure in a mobile device, even if that mobile device goes missing, which occasionally it will. So these are all theoretical considerations and theoretical ideas. What I'd like to do now is turn the podium over to Dr. Appia and have him talk about an ongoing education program in Ghana and give you a real-world experience.
Thank you. Thank you very much, Mark. This is Ghana, and Ghana has a population of 24 million, and it's in the western part of West Africa, in Africa. It has the size of Great Britain. In the early 90s, we lost a lot of staff through brain drain, doctors, nurses, health personnel, and in making up, we had to establish more schools, expand the old ones. So the schools increased from 19 to 90 in 7 years. Now I have 25,000 students and high enrollment. But all these are at a cost, because the infrastructure was challenged. We had books problems, we had staff problems, and the students' motivation was low. Academic performance slumped to about 50%. So a quick assessment revealed that the gap was actually technology, and that is how we came to mobile phone. So we entered a public-private partnership with UNFPA, with Intel and Japago. The idea is to standardize contents across board, develop content so that all the schools can use, and then make get affordable mobile phones, equipment, or tablets, netbooks, so that the students can purchase from their scholarships. An Intel school has provided a platform for which we can use. The device, we chose netbooks instead of mobile because of the cost effectiveness of it, and it also enables knowledge creation than consumption. So far, 10,000 netbooks will be distributed in December to all the schools, and the e-learning platform and content creation will be implemented over 2 years. I was the director of the human resource, but I moved to the Ghana Health Service as the director general, and I intend taking along with me the mobile phone. This time around, we'll use it in training, in-service training of over 50,000 people, and that is why I'm here today. So you'll hear about that maybe during the discussions with Mark. Thank you very much.
Dr. Appia, you described a program where you're using mobile devices to provide in-service education for citizens right now, for educators, for students in your country. You described where phones might come in. Take me out about 5 years. Take me out for what your vision of how mobile technology actually will help transform the Ghana Health Service over that period of time.
Well, that's a good question. I expect that in 5 years' time, all people living in Ghana may be using mobile phones somehow in transmitting health information either to colleagues or to patients in the home. For the health sector, we use it in helping patients, reminding them of the time they should take their medication, and especially the pregnant women reporting to the clinic. We also use it in referral. In Ghana, we have a system where we have the community health nurses in the community. Then at the higher level, we have the field physician assistants, then the doctors. So in referral and helping the diagnosis, you can also use the mobile phone in doing all those kind of things. For the netbooks, we need it for more complex activities. For example, the training. We expect that we could use it in expanding the number of students that we take and also providing quality in terms of uniformity when it comes to the contents. We also use it in in-service training. I was talking about 50,000 workforce, and we expect that instead of them moving to the center always for training, we will now send the training to them in the periphery. We could also use it in handling commodities. Usually we run stockouts in the deprived areas, and it should be possible that at the center we'll be able to identify those who need logistics so that they can be supplied to them. We also use it in collecting data, service data, human resource data, financial data. So for we can use it for a lot of things in Ghana, and I expect that in 5 years' time a lot of things will change.
So it seems that you're already expressing that initial thought that I kind of ventured, the right tool for the right task.
Exactly.
Certain devices with larger real estate seem to help better with consumption of data to do the training activities, whereas tracking materials, the commodities, the phone might be the ideal tool for something of that nature. Yes. Going forward. Well, you know, this vision sounds absolutely fantastic going forward, empowering people with the data and the mobile devices. But how do you get started? What do you do next to get on that journey?
Well, I took over as the Director General of the Ghana Health Service barely a month ago. And the first thing I did was to bring together all the pilot thing that we've been doing. And the idea is to form a committee and then brainstorm on the way forward, which ones are we supposed to scale up. And obviously, we need a private sector participation. So we invite the private sector to support us in developing the programs. And Ghana, we have a nice policy on PPP as well as ICT application.
So how do you get started with these public-private partnerships? Are there any concerns? Are there any issues that you start to face going forward?
Yeah, we will certainly lack. We're challenged with capacity. So we need training, capacity building, and then we also need the devices. We need large numbers of devices for students, for health workers. I'm talking about 90,000 people, including the private sector as well. And we need a capacity management of the whole program. So it's just a matter of capacity building.
So 90,000 people with mobile devices of various sorts, doing different tasks and interacting together in this environment. The issues around building the partnerships, and how do you reach out, or what do you do to organize them? Have you created policies or activities in Ghana that enable that to start to move forward?
Yes, we have the private-public partnership policy driven by the Ministry of Finance and Economic Planning. And then we have a policy on ICT, so that anytime anybody wants to apply something, you have to get to the Ministry of Finance for them to support you. So we have the enable environment.
And you mentioned the funding. How do you reach out for the funding, or what do you do to actually attract the dollars to Ghana, the resources as you describe that?
Well, in the private sector, I think after you've listened to us, looking at the number of people that we are talking about, I tell you that Ghana, we have an enabling environment to attract you. Even though elections are coming on very soon, I promise you that there will not be any change. Whoever wins, there'll be an enabling environment for us to proceed with what we want to do.
So a framework has been developed,
yes.
Policies have been put in place
yes.
to attract the investment dollars. There's a stable political system despite changes in democratic elections, and the country is moving forward with a cohesive strategy for delivering mobile technology to improve the healthcare system.
Precisely.
Brilliant. Well, you have a great audience here, some people that might want to do public-private partnerships with you. What would you like to ask them to do to you and to help Ghana with?
That's a good question. I wish to invite all of you to invest in Ghana. We have over 90,000 people waiting for health professionals. We have over 2,000 health facilities and about 20% more in the private sector. And we have 24 million people. Ghana, everybody is hungry for mobile technology. And I wish to invite you to invest. And I tell you that there will not be any failure or maybe any change in policy should any government come to power. So you're all invited to Ghana, and I appeal to you that you help us to improve the lot of our people, especially when it comes to development, training, when it comes to consumables management, when it comes to infrastructure for ICT. So you are all welcome to Ghana, and I hope that you invest in Ghana. Thank you very much.
That sounds like a wonderful vision, and if you come, I bet you get dinner out of it as well.
Yes.
This actually is a wonderful idea here. This is what we're talking about with using mobile tools to actually transform a healthcare system, putting policies in place, putting activities in place, driving the public-private partnerships, looking at the task-based activities that the mobile tools can help drive, using them appropriately for education, for diagnostics, for analytics, for training. The plethora of things that mobile tools can do to transform a healthcare system in Ghana is Dr. Appiah's vision. I think you're all welcome to contribute, and that's what he's asking for. We need to use our imagination and innovation to let mobile transform healthcare. We shouldn't be stuck in the paradigms that we're initially developing. We should let our imaginations free and allow mobile technology to truly transform the healthcare systems of the future. Well, thank you for letting us share this vision with you for a few minutes. Thank you very much.
Thank you.
Worldwide.